This conference will now be recorded.
Hi guys, my name is LaDonna Cavanis and I am an instructor here at Ultimate Medical Academy, and today we're going to be going over anatomic reference systems. So let's get started. So anatomic reference systems are used to describe locations of structural units of the body that when grouped together form a body system. Reference systems include body planes, body directions, body cavities, and structural units. Let's talk a little bit about anatomy and physiology. Anatomy is the structure of the body, and physiology is the study of function of the structures of the body. So physiology is the study of the functions of those structures in our bodies. Anatomic positions, they describe body erect, facing forward, holding arms at your side with palms or hands facing forward. Body planes are simply imaginary vertical and horizontal lines used to divide the body into descriptive sections. Mid-sagittal divides the body into equal left and right halves. As for transverse, divides the body into superior, upper, and inferior, lower portions. Frontal divides the body into anterior front and posterior back portions. Here's a diagram, body planes. So if we take a close look at the diagram, at the top, the mid-sagittal plane, it's left and right. Then you have the superior portion, inferior, the midline. The transverse plane is right there in the center. And then you have the frontal plane toward the bottom. And just here's another illustration of that. Body direction terms. Ventral refers to the front of the organ body. Dorsal refers to the back of the organ or body. And keep in mind that when we talk about the acronyms VENTR, which is a prefix, we're looking at the belly side of the body. And AL means pertaining to. When we look at dorsal, which is the back of the body, DORS equals back of the body. As for AL equals pertaining to. Anterior is situated in the front and posterior is situated in the back. And when we break that down, ANTER, which means front or before, and IOR, which equals or means pertaining to. Posterior, when we break that down, POSTER refers to back or toward the back, and IOR refers to or means pertaining to. Superior is the uppermost or above or toward the head. That's what we're talking about when we talk about superior, toward the top. Inferior is lowermost, below, or toward the foot, so closer to the lower part of the body. Cephalic, toward the head, and caudal, toward the lower part of the body. When you break cephalic down, CEPHAL means head, and IC means pertaining to. When you break caudal down, CAUD, it refers to the tail or lower part of the body. As for AL, means pertaining to. Proximal is situated nearest to the midline or the beginning of the body structure. As for distal, is situated farthest from the midline or beginning of the body structure. Medial refers to toward or near the midline. As for lateral, refers to toward or nearer the side of the body away from the midline. All right, so here we're talking about body direction terms. Let's look at this example. So anatomical planes, anatomical position planes. So when we look at this image here, when we look at the coronal, which is frontal plane, it's in this red section here. So that's what they're referring to, this section here. When we look at the sagittal portion, that's the green section here. Okay, and when we look at the axil, they're talking about this section here, which is horizontal or transverse plane. It divides the body into upper or lower segments. Sagittal and median divides the body into equal left and right sections or parts. And coronal divide or frontal divides the body into front and back sections. And here's just another illustration of how the body can be divided using these planes. Major body cavities. Dorsal cavity located along the back of the body and head contains organs of the nervous system. Divided into two portions, cranial cavity located within the skull surrounds and protects the brain. Spinal cavity located within the spinal column surrounds and protects the spinal cord. The ventral cavity is located along the front of the body, contains body organs that sustain homeostasis. And you can break that down here, homeostasis. So homeo refers to constant and stasis refers to control. Divided into thoracic cavity surrounds and protects heart and lungs separated from abdominal cavity by the diagram. Abdominal cavity contains major organs or of digestion. Pelvic cavity formed by hip bones contains organs of reproductive and excretory system. And here's another illustration of how the body is broken down. We're talking about the cranial cavity, the dorsal cavity, the spinal cavity, and pelvic cavity. Thoracic cavity is here. Ventral cavity is here. Abdominal cavity is here, and here's the abdominal pelvic cavity. Regions of the thorax and the abdomen. So right and left hypochondriac regions, covered by lower ribs. Hypo means below, chondral means cartilage. Let's take a look at the epigastric region, located above the stomach. Epi refers to above, of course, and gastr refers to stomach. Right and left lumbar regions, located near inward curve of the spine. LUMB, lum, refers to lower back. Regions of the thorax and the abdomen. Umbilical region surrounds the umbilicus. Right and left iliac regions located under the hip bones. Hypogastric region is located below the stomach. All right, regions of the abdominal area. So if we take a look at this diagram, the right hypochondriac region is located here. The right lumbar region is located here. The right iliac region is located over here. Left hypochondriac, left lumbar, and left iliac. So it's just opposite of the right. And in the center here, we have the epigastric region, the umbilical region, and the hypogastric region. It's located in the center area here. Quadrants of the abdomen. Division made by the use of 4 imaginary lines of the abdomen. So when we refer to the abdomen, we could be referring to 4 different sections of that body part. And this is very important to know if you're planning on becoming a medical coder, because a lot of documentation is specific to right or left or upper or lower. So I know with the implementation of I-10, these codes are much more specific. The specificity is there versus I-9 codes. When we had I-9, there was not all this specificity. There was right and left side, but it wasn't specific to whether or not they were talking about the upper or lower quadrants. So the implementation of I-10 has been very, very, it's a good system because it actually breaks everything down to very specific parts of the body. And here's just an illustration, a diagram of these parts of the abdomen, as we mentioned in this slide here, the slide before. This is just an image of the breakdown of those sections. Peritoneum, multi-layered membrane. It protects and holds the organs in place within the abdominal cavity. Peritum, outer layer, lines the interior of the abdominal wall. The mesentery, double layer, attaches parts of the intestines to interior abdominal wall. Visceral peritoneum is the inner layer and it surrounds the organs of the abdominal cavity. Multi-layer membrane protects and holds the organs in place within the abdominal cavity. Peritoneal outer layer, it lines the inferior or abdominal wall. Mesentery is the double layer, it attaches to the parts of the intestines to the inferior abdominal wall. And visceral or peritoneal, which is the inner layer, surrounds the organs and the body cavities. Structures of the body include cells, tissues, organs, and body systems. Cells are basic structures and function units grouped together to form tissue and organs. Cytology, study of the cell, and here's a breakdown of the medical term cytology. So CYT refers to cell, and we know that ology refers to the study of. So cytology, cytologist and study and analyst of cells. Structure of membranes, cell membranes, semi-permeable membranes surrounding and protecting contents of the cells from the exterior environment. Cytoplasm material within the cells and the membranes are not part of the nucleus. The nucleus controls activities of these cells. Stem cells differ from other cells because of the two characteristics. Unspecialized cells able to renew themselves for long periods of time may be transformed into cells with special functions. Adult stem cells, undifferentiated cells located among differentiated cells in tissues, organs, not specialized functions or structures, harvested for transplantation for homeopathic tissue of the donor's bone marrow. Embryonic stem cells, undifferentiated cells, ability to form any adult cell, proliferate indefinitely in laboratory, do not require perfect match between patient and the donor when transplanted, obtained from umbilical cord, blood, placenta, or surplus embryos produced by in vitro fertilization. Genetics. Study of the transfer of genes from parent to child and the role of these genes in health disease. Here's a breakdown of that medical term. GEN refers to producing, and TICS refers to or means pertaining to. Gene, fundamental physical functional unit of hereditary. Dominant and recessive genes. Dominant gene inherited for either parent. Offspring will inherit that condition condition or characteristic. Same recessive gene inherited from both parents. Offspring will inherit that condition or characteristic. Dominant and recessive genes continue. Recessive genes inherited from one parent and normal gene inherited from other parent. Offspring will not inherit the condition. However, condition may be transmitted to his or her offspring. Very interesting. The human gomium, complete set of genetic information of the organism, important in studying the use of genetic in health science. Chromosomes, genetic structures located within the nucleus of each cell, made of DNA molecules containing the body's genes. Somatic cell, any cell except gametes, contains 46 chromosomes, 23 pairs, 22 identical pairs plus XX pair, female or XY pair, male. Gamete, sperm or egg, has 23 single chromosomes. The X or Y chromosome from father determines gene of the child. Defective chromosomes can lead to birth defects. I found this to be interesting here, very interesting. DNA. Basic DNA structure is same for all living organisms, found in nucleus of all types of cells except erythrocytes. No two DNA patterns are exactly the same except those of identical twins. Identical twins have unique characteristics such as different fingerprints. Genetic mutation, change in the sequence of DNA molecule. Somatic cell mutation, change within the cell of the body cannot be transmitted to the next generation. Gametic cell mutation, change within the gene and the gametes can be transmitted. Genetic engineering, manipulating genes for science and medicine. Genetic disorders, pathological conditions due to absence of defective gene. Some are obvious at birth, others manifest later in life. Examples include, but are not limited to, cystic fibrosis, homeophilia, and penlicturia. Tissues, a group of layer of similarly specialized cells that perform certain function. Histology, microscopic study of tissues. Histologist, non-physician specializing in the study of microscopic structures of tissues. And this is what this medical term looks like broken down. HIST refers to or means tissue, and ology again is the study of. Okay, tissues. There are four main types. So epithelial tissue, connective tissue, muscular tissue, and nervous tissue. Those are the four main types of tissue. Okay, so epithelial tissue protects covering for interior and exterior surfaces of the body. Epithelial specialize for formation of the epidermis of the skin and surface layer of mucous membranes. Endothelium lines the blood, the lymph vessel, body cavities, glands, and organs. Connective tissue supports, connects organs and other body tissues. There are four types: dense connective tissue, which forms joints; adipose tissue, which provides padding, insulation, and support. And here's a breakdown. ADIP refers to or means fat, and OSE refers to pertaining to. The other two are loose connective tissue, which surrounds various organs, supports nerve cell and blood vessel, and liquid connective tissue, blood and lymph, transport nutrients and waste products throughout the body. Muscular tissue. Okay, muscular tissue contains cells specialized to contract or relax, I should say. So about half of your body's weight is muscle. In this muscular system, muscle tissue is categorized in three different distinct types: skeletal, cardiac, and smooth. Each type of muscle tissue in the human body has a unique structure and a specific role. Skeletal muscle moves bones and other structures. Cardiac muscle contracts the heart to pump blood. The smooth muscle tissue that forms the organs, like the stomach and bladder, changes shape to facilitate body's function. Here are some details about the structure and functions of each type of the muscle tissues in the human musculoskeletal system. All right, so nervous system or nervous tissue contains cells specialized to react to stimuli and conduct electronic impulses. Nervous tissue is one of four major classes of tissue. It is specialized tissue found in central nervous system and in the peripheral nervous system. It contains the contents are neurons and supporting cells called neural ganglia. The nervous system is responsible for the control of the body and the communication among its parts. Nervous tissue contains two categories of cells: neurons and neuralgias. Pathology of tissue formation. Defective tissue formation, often due to unknown causes, may occur as tissue forms between birth or may appear later in life. Incomplete tissue transformation. So aphasia, it's defective development of congenital absence of an organ or tissue. Hypoplasia, deficient in number of cells leading to incomplete development of an organ or tissue. And here's a breakdown of each of those medical terms. So aplasia, A refers to or means without. Plasia is the formation or refers to formation. Hypo is deficient, and plasia refers to or means formation. Anaplasia, it's the change in structure of cells and their orientation to each other. Ana refers to backward. Dysplasia, abnormal development growth of cells, tissues, or organs. Dys refers to bad, not good. Abnormal tissue formation continues. Hyperplasia refers to increase in number of cells resulting in enlargement of organ or tissue. Hypertrophy refers to increase in bulk of body part organ due to increase in size but not in number of cells. And here's a breakdown of that term. Hyper refers to or means excessive, and trophy means development. Glands, group of specialized epithelial cells capable of producing secretions. Two major types: exocrine, secrete chemical substances into ducts, and endocrine, produces hormones, no ducts. And here's a breakdown of these two medical terms. So EXO refers to out of, and CRIN refers to secrete. Endo refers to within. Pathology and procedures of the glands. Adenitis, inflammation of the gland. ADEN means gland, and itis means inflammation. And you'll see itis used quite often throughout the healthcare industry. It's a very commonly used suffix. Adenocarcinoma. Whenever you see that medical term carcinoma, it refers to malignancy. So it is not benign. benign, it refers to a malignant tumor. Adenocarcinoma, malignant tumor originating in the glandular tissue. And here's a breakdown of adenocarcinoma. ADEN with your combining vowel O, which means gland, carcin, CARCIN, which means cancerous, and OMA, OMA means tumor. Adenoma, when you see this term, this refers to benign tumor arising in or resembling glandular tissue. So adenoma refers to benign tumor. Adenocarcinoma, remember, whenever you see that carcinoma, that is a malignant tumor. Pathology and procedures of the gland. Adenosis, any disease or condition of the gland. Osis, O-S-I-S, abnormal condition or disease. Adenosclerosis, abnormal hardening of the gland. Sclerosis refers to or means abnormal hardening. Adenectomy, surgical removal of a gland. ECTOMY, ectomy, refers to surgical removal of something. Body systems related to organs. Body organ performs specific functions. Body systems is the organization of body organs with specialized functions. Pathology is the study of PATH with your combining vowel O, or pathy, diseases or disease or suffering, feeling, emotion. Pathologist is a physician who specializes in laboratory analysis of disease tissue samples. Etiology is the study or cause of a disease. ETI means cause of something, cause of a disease. Disease transmission. Pathogen, disease-causing microorganism. Transmissions, that's the spread of disease. And contamination, it's that of a pathology that is present due to lack of hygiene standards or failure to practice appropriate infection control. Okay, disease transmission. Communicable disease transmitted from one person to another by direct or indirect contact. Indirect contact transmission. Susceptible person is infected by contact with contaminated surface. Bloodborne transmission, spread of disease by contact with infected body or body fluids. Droplet transmission, the spread of a disease by large respiratory droplets produced by the act of coughing or sneezing. And this is, I don't know, this is kind of like, what we're going through with the COVID-19. They're considering it to be a respiratory condition. Airborne transmission, spread of disease by contact with germs floating in the air. Okay. Disease transmission continue. Foodborne or waterborne transmission, fecal, oral transmission, spread of a disease due to eating or drinking contaminated food or water. Vector-borne transmission, spread of disease due to bite of a vector. Most common vector is a mosquito. All right, outbreaks of disease. Epidemiologists is specialized in the study of outbreaks of diseases with a population group. When we break that term down, EPI refers to above, DEM with the combining form I refers to population, and ologist refers to specialist. Endemic, ongoing presence of disease within a population group. EN means within, DEM, population, and again, IC means pertaining to. Epidemic, sudden, widespread outbreak of a disease within a specific population group. And pandemic is epidemic, it's outbreak of a disease occurring over a large geographic area. And so right now, currently with COVID-19, we're experiencing a pandemic. And this pandemic is like it's all over. So it's complicating large geographic areas, and it's not just specific to one area or specific to a population, a group of people. Types of diseases: functional disorder, producing symptoms for which no um, physiological anatomical cause is identified. Iatrogenic illness is unfavorable response to prescribed medical treatment. And infectious disease, illness due to living pathogenic organisms. Types of diseases continue. A nosocomial infection, disease acquired in the hospital or clinical setting. And organic disorder is normally due to detectable physical changes in the body. Congenital disorders exist at the time of birth. Development disorder, birth defects resulting in anomaly or malformation. Prenatal influences includes mother's health, behavior, and whether or not she seeks prenatal medical care while being pregnant, of course. Premature birth and birth injuries. Premature birth occurs earlier than 37 weeks gestation. Birth injuries, congenital disorders which were not present before the event surrounding the time of birth. Aging and death. Aging leads to higher risk of developing chronic or eventually fatal health problems. Geriatrics is the study of medical problems or care of elderly people. Postmortem, after death. Autopsy, postmortem examination. Healthcare professionals. General practitioners provide ongoing care for all ages. Internists specialize in diagnosing and treatment disorders of internal organs, and pediatrician specializes in treatment of infants and children. Geriatrician specialize in the care of older people. Nurse practitioners are nurses with graduate training working under the supervision of a physician. So nurse practitioners, they can treat patients just as a MD or a DO would. Your physician assistant, here's another licensed professional working under the supervision of a physician, and they also can treat patients. They see patients as a MD or a DO would. Medical receptionist schedules and registers patients for appointments. Medical assistant performs medical or administrative clinical tasks. And medical coder reviews medical records and assigns appropriate codes for treatments and services. Emergency physician specializes in high acuity medicine in the emergency room. Emergency medical technician is a licensed healthcare professional working in a pre-hospital setting. And a registered nurse, of course, is a licensed healthcare professional who assumes and provides care for patients. Licensed vocational nurses work under the supervision of a doctor or RN. Certified nursing assistant, they provide basic patient care. And a pharmacist is a licensed medical professional who dispenses prescribed medications. Healthcare professionals continue. Intensive care units, site of continuous monitoring of critically ill patients. Internist specializes in the care of critically ill patients. Hospitalist Position focuses on general medical care of a hospitalized patient, so a patient that's inpatient status. Telemetry unit provides continuous cardiac monitoring, electronic transmission of data for patients with heart problems not requiring intensive care. Medical and surgical unit provides nursing care for lower acuity patients who require continued drug therapy or monitoring. All right, that's the end of my presentation, guys. Thank you for joining.